Hello, I'm Dr. Inman. This is a miniature lecture on cardiovascular disease in the canine particularly. We can also discuss that in the feline and the equine, but mostly this is developed for the cardiovascular disease condition in the canine. As far as cardiovascular disease in the dog, essentially, it can be an arrhythmia, it can be congestive heart failure, it can be tricuspid or bicuspid insufficiency, stenotic valves, mitral insufficiency, etc., etc., etc. It's important to understand that the heart is, due to Starling's law, is an organ that will continue to change in its architecture based on the need for it to pump more and effectively more blood through the system. And it's just a factor of blood supply or oxygen supply to the tissues, including the tissue of the heart. We know that the heart is an organ full of blood, and essentially an organ full of blood could not be starved for blood, but in fact that is the situation. If you increase the sympathetic tonus of the great vessels of the heart, what you do is you basically knock down by about 30 to 40% the amount of blood that's actually flowing to the heart muscle, so it doesn't function as well as it can. Now, if it can't, basically we have a degree of partial anoxia, lack of blood supply. And due to Starling's law, the heart basically will enlarge itself to try to pump more blood. As it does that, as it enlarges essentially, it also changes its architecture, and the valves basically, which usually come to a nice blood-tight seal, basically don't come to a seal. We end up with mitral insufficiency, a heart murmur, we end up with congestive heart failure, which we'll talk about in other disease conditions. But the arrhythmias, the congestive heart failure, the mitral insufficiencies, all of these conditions are actually held in place by, you know that we're going to tell you this because this is what we've worked with for the last 35 years, a phenomenon of neurological interference occurring in the paraspinal tissues of the body of the canine, essentially. We're not talking about in the spine, but spine anomalies actually produce inflammation that are paraspinal in nature, which elevate the sympathetic tonus, which decrease the parasympathetic tonus concomitantly, and then basically it compromises the blood supply through the great vessels of the heart and also the cardiovascular system in general. So essentially what's happened is all the vessels, including the vessels to the heart, are shrinking down in a response to increased sympathetic tonus. So increased sympathetic tonus, also called stress, essentially will predispose to cardiovascular diseases. The way it manifests itself, congestive heart failure, mitral insufficiency, heart murmur, arrhythmias essentially, is dependent upon the animal's own unique biological and genetic predisposition to manifesting one of those disease processes essentially. And so what we will do with these animals almost always is we adjust them as we always do, and we'll show you how to do that on the vomtech.com website. And then on module 4 essentially we show you how we go about adjusting the autonomic nervous system, where we go back in and we actually reset all of the sympathetic nerve bundles, which are the parasympathetic nerve, the paravertebral ganglion that come up and down the just outside of the spinal cord area, and optimize them. They are artificially elevated. We bring them back down to normal, which allows the parasympathetic to come back to normal. Another way to do that too, we do with the laser. What we can do is we can laser the frequencies for the cardiovascular system using a two-point laser situation where the preset head goes into the thoracic inlet, and we're lasering the body essentially in this capacity, back and forth, back and forth. The frequencies we'll use were frequencies for the heart, which is 33 and 66. We'll utilize frequencies for the arterial system, which is 100, and also for the lungs. We'll also laser for the venous system, which is 4, essentially, and also the brainstem is 4 too. And then we'll also use 300 for frequency for capillary. And these particular frequencies can be delivered for about 180 seconds, delivered twice a day for 3 days, once a day for 3 days, twice a week for 2 weeks. It is delineated extensively in the courses that we deliver on frequency-specific laser therapy, and I invite you to go to the website at vomtech.com and look at that, and look at what it is that we see. In the next lecture, we'll talk about congestive heart failure specifically, and how we go about taking care of that with and without the use of medications or handling these conditions with just using adjusting and lasering techniques alone. Thank you very much, and have a great day.